Hi everyone. Welcome to Center of Balance Live. I'm Phua from Center of Balance, the acupuncturist. Thank you for joining us. Just give me a thumbs up and say hello, me. You're here. Our topic today. Hi, happy day. How are you? Our topic today is acupuncture treatment for fibroids. Acupuncture treatment for fibroids. Well, I'm doing well, thank you. Now you're here, please say hello and give me a thumbs up and share this live video, please. Thank you very much. Right. Hi, Veronica, how are you? Thank you very much for joining us. Let's start. Okay. Well, let's start straight away. So I'm going to give you some acupuncture point strategy for treating fibroids. Right. We haven't go through how Western medicine to treat fibroid yet, but we're going to go through tomorrow probably. This is the strategy that we use for fibroid. As the acupuncturist, you may see this already. When did we talk about this? We talked about this in PCOS. So when it comes, we have a lot of different strategies, right? This is just one of them. Okay, the one of them is medical aid for OBGYN, right? Now you may want a pen and paper to write down this point. If you've done this before and you don't need it, okay? I have took a photo of it to post on our acupuncturist Facebook group, okay? And that group is only showing you'll be able to access to that group if you're an acupuncturist, okay? Yeah, so I'm going to name the point for you, and that's just one of the strategy that you can use for fibroid, PCOS, and any OBGYN cases, okay? So let's, on the right side, okay, on the right side, and that is here, Sanjiao 4 and 1, large intestine 1 and 4. Okay, Sanjiao and large intestine 1 and 4. Right. What it is. Okay. Hi Julia, how are you? Then on the right side, spleen 1 and 4 and kidney 1 and 4. It's all 1 and 4, you see? It's pretty easy to memorize. 1 and 4, spleen, kidney, large intestine, and Sanjiao. On the left side, heart 3, 7, PC 6, 9, and gallbladder 34, 41, stomach 45, 42. Right. Stomach 45, 42. Right. Gallbladder 34, 41. Pericardium 6, 9, heart 3, 7. Sanjiao 1, 4, large intestine 1, 4, spleen 1, 4, kidney 1. right? Those are the point. Okay, this is just one of the strategies that you can treat fibroid with acupuncture. This is we call distal point, treat the organs, okay, and the meridian. Where else can you put needles? Okay, where else can you put needles? In general, you can treat it like this, okay. You can put needle over here, lower abdominal, 子宫关元气海, a great point for it. Okay. And the groin, or the 第五会, 阴连, all this point are very good for it. Okay. Now, what about 八髎? 八髎are used the most. Okay. On the local needling, 八髎I find is the best. Okay. Needle 八髎with the strong sensation. And when is the best time for 八髎? Especially when you lead up to period. When period due, before period due, start needle 八髎, and one during the period, during bleeding, then 八髎is must. You must needle 八髎, because 八髎got a very strong sensation. It puts the blood clump. When you put the blood clump, it can remove the stagnation of blood and stagnation of dampness, mucus. If the fibroid is inside of the uterus, you may have the chance to push it out. But this is the way that actually the fibroid can fall off the uterus and came out. But it doesn't work while it can't fall off if the fibroids go on top of the in the outside of the uterus. It doesn't work that way, and that has to be absorbing, and it's much difficult to deal with. Okay, and doing OBGYN in this part, it can help string down the fibroid. Okay, and the OBGYN over here is hormone balance as well. Female hormone balance points in there and meridians there. So it helps to balance the hormone. Right? So when you're treating fibroid, you're not just, take care of, oh, I want to remove the fibroid, You think about what causing fibroid. It's the hormone imbalance. You want to balance the hormone. And OBGYN is one of the best strategy for hormone imbalance. Okay, so treating that. And you think about it, PCOS, hormone imbalance, we do this as well. Right? But if we come to Western medicine, it's different, totally different. The PCOS is about the male hormone increase and female hormone decrease, and come to fibroid as the female hormone increase and male hormone decrease, right? And what happened in here is, in Chinese medicine, we use the same strategy. We use the same strategy because we are not actually giving something to patient to replace the function. We are actually restoring the function. To restoring the function, we use this strategy. Okay. So this is one of the strategy for acupuncture. What about Chinese herbs? 桂枝茯苓丸, one of the best. And we've been saying about 桂枝茯苓丸 for PCOS, right? Yes, that's right. 桂枝茯苓丸 for PCOS, for fibroid. Use it for both. Again, you see, fibroid, PCOS. Why is that? Because they both form cyst and fibroid form from mucus, from dampness, from blood stagnation. That's why we use 桂枝茯苓丸. Then according to that patient, whether it's weak stomach or diarrhea, bloating a lot, and you on top of 桂枝茯苓丸, you can add on 参苓白术散, you can add on 理中汤 to strong the spleen and stomach. Or if it's kidney yang deficiency, you add on 八味地黄丸, right? Or if it's yin deficiency, you can add on what 淄博地黄丸, 六味地黄丸, something like that. So the herbs is similar to that way, but I don't use this kind of herbs right now. I more go on and take the pose and find out which pose we need to focus, which pose are the strongest or which pose are weakest, and then we treat it. The same as acupuncture. We balance the pose. Okay, so this is one of the strategy. If I come to pose diagnose, I take the pose and I find out, okay, this patient has weak pose of the stomach and spleen are the weakest. Then when it's weakest, I choose 桂枝茯苓丸 and 理中汤. And when we choose 理中汤, what we do, we needle the mother point of spleen and stomach. Okay. If we needle the mother point of spleen and stomach, what else can we needle? We can needle the heart and small intestine, because heart, small intestine is fire. Fire supports earth, right? Earth's weak, then we support the heart and small intestine. So we needle the mother point of heart and small intestine. That's it. Then we decrease the kidney and bladder, because when the water decrease and the earth and the fire will improve together. So we needle the sun point of kidney and bladder. That's it. This is another strategy according to the pose. So what causing fibroid? According to Chinese medicine, any organs can cause fibroids imbalance. It can cause the organs imbalance and lead to hormone imbalance, then cause fibroid. Now, how do we know which one we need to treat? And we go for asking the question, you get a lot of different answers, a lot of symptom conditions, and all the conditions related to all organs, a lot of different organs. And how do we treat it in here? We take a pose, we find out which one out of balance the most, and then we treat it directly. We focus on that first. Does it mean if you treat the stomach and spleen now, and the next treatment or the next couple months, a couple weeks, you only treat stomach and spleen? No. We change it. Why do we change it? We change it according to the body, according to the organs we balance. When the organs we balance to this stage, we change. We do some herbs and acupuncture to suit this stage. When it improves the other stage, we change the strategy. So we constantly change the strategy because of the organs is improving. Then we change the strategy. Right? The strategy change all the time. Right? But our goal, the strategy under the goal, is actually removing and try to shrink down the fibroid. That's it. Right. So this is what we do. Happy Days asks, can one needle the back point on mental anemia here? And what is the name of the back point? 八髎. 八髎is, yeah. 八髎used in OBGYN, just like this one. 八髎used for any OBGYN cases. But 八髎can use in any OBGYN cases. Right? But when it's coming too much of period, like bleeding a lot, you don't use bile. So in these cases, if patients are weak, then you don't use bile. Bile is very strong to push the blood out. If they're coming too much of blood, you don't use bile. Or you use bile with very light stimulation. Just put it in, don't twist the needle, don't give strong stimulation, then that's pretty okay. Yeah. It all depends on, but bile like OBGYN, used for any OBGYN cases. Does it make sense to you? Right. Let's say what we talk about the spring wig, right? Now we use that, and we can use Chinese herb for Li Zhong Tang plus Gui Zhi Fu Ling Wan, right? What else can we do? If Li Zhong Tang and Gui Zhi Fu Ling Wan, the same diagnosis of spleen and stomach weak, then we use Li Zhong Tang, right? If Li Zhong Tang doesn't work very well, then what we do? We can use iron triangle strategy, which is I just did that. Bile is on, yeah, UV meridian. That's right. Over here. It's all bile in here. Bile point. So the iron triangle strategy is like this, okay? We can use herbs. So we use 2 points to improve tonify stomach and spleen, right? 1 point each meridian, right? Then we use 2 herbs. One is ginseng, one is ginger, right? That is for stomach and spleen. What about using for heart and small intestine, right? We use the mother point of heart, mother point of small intestine. Then when it comes to herbs, we can use Huang Nian and Xuan Fu Hua. That's it, you see? 4 point acupuncture point, 4 different herbs. And what about kidney? Yeah, kidney. Kidney, we use the sun point of kidney and bladder, right? Then in herbs, we use Fu Ling and Shen Di. You see, we use 6 different points to balance the pose, and then we use 6 different herbs to balance the pose to treat fibroids. So this is another strategy that I use it every day and often, and actually my first strategy for any of my kids. And that's another one. Then I can add on this if I wanted to. Right. But for you, is the reason I show you this strategy, medical aid, OBGYN, is because it's not relying on pose. Right? You can just, wow, fibroid, is OBGYN problem? You just put the needle in. So much simple, right? But am I saying, I'm asking, does it work for all of them? No. You need to test out. If it doesn't work as well, then you need to change the strategy. But this is the first point that you can use. For me, I can take the pose and I choose, you know, if the pose can be balanced, then I keep going to do that. If the pose keep up and down, and the patient respond not very well, then I can change to this strategy. So there are many other strategies. Okay, that's it for today. I hope you find this help. Okay, I have a very early appointment today at 8 o'clock, and now it's about 25 past 7. Then I should go to the clinic. All right, stay awesome, and I'll see you tomorrow. Thank you very much. See you. Bye bye. If you have any question, please leave it down there. Otherwise, I'll see you tomorrow. Okay. Thank you. Bye bye.